In this video, we're going to cover acute pancreatitis, which is a life-threatening condition affecting the pancreas. The etiology of acute pancreatitis can be summarized using the mnemonic "I get smashed," where I is idiopathic, meaning it's an unknown cause. G is for gallstones, which can obstruct the pancreatic duct, causing increased luminal pressure and subsequently activation of pancreatic enzymes. The E is ethanol, so alcohol use. The T is trauma, so traumatic injury. Now moving on, we have steroids such as prednisolone or budesonide, mumps, which is a salivary gland infection, autoimmune conditions, scorpion stings, which are extremely uncommon, and hypercalcemia and hypertriglyceridemia. And finally, we have endoscopic retrograde cholangiopancreatography, which is an imaging study used to look at the liver, gallbladder, pancreas, and bile duct system. And also drugs such as GLP-1 analogs, which includes the drug Ozempic. The pathogenesis of acute pancreatitis involves three main features. These features include autodigestion, the three contributing factors, and the triggering event. Firstly, autodigestion of the pancreatic tissue is caused by inappropriately released and activated pancreatic enzymes. This may be contributed to by duct obstruction, which raises intrapancreatic ductal pressure and leads to the accumulation of enzyme-rich fluid in the interstitium. There is also acinar cell injury, leading to release of digestive enzymes and lysosomal hydrolases, which activate proenzymes, and also defective intracellular transport, which causes the inappropriate activation of pancreatic proenzymes. Lastly, activation of trypsinogen into trypsin is an important triggering event in acute pancreatitis. This proenzyme activates other proenzymes including phospholipase and proelastase, which causes damage to blood vessels and activates the clotting and complement systems. Now we will have a look at the macroscopic and microscopic features of acute pancreatitis. The key macroscopic features of acute pancreatitis include edema and congestion, hemorrhage, necrotic tissue, which is brown or black in color, and fat necrosis, which features characteristic white or yellow foci. Meanwhile, the microscopic features of acute pancreatitis include edema, fat necrosis due to the action of lipolytic enzymes, acute inflammation with a neutrophilic infiltrate, pancreatic parenchyma damage, blood vessel damage due to elastase, which causes interstitial hemorrhage. The complications of acute pancreatitis include pancreatic abscess, pancreatic pseudocyst, duodenal obstruction, infection and subsequently sepsis, and death due to multi-organ failure. The diagnosis of acute pancreatitis is reliant on serological and clinical manifestations. However, lipase is the most sensitive marker for the condition, which has since replaced amylase in most laboratories. However, please consult your local hospital guidelines, as this may be different in your state or country.